Now we're going to talk about family therapy. It's a very interesting topic, pretty new form of therapy. I have included under your content tab a list of links to help explain family therapy, and I strongly suggest that you look at those links for some clarification throughout this chapter. Basically, family therapy is under the guise of understanding that every member of the family is connected, and the relationships amongst the family can create problems for a person, not just people with mental illness, but all peoples in general. And how well the family functions can affect each individual member of the family, and that each individual member of the family affects the family. Also, it discusses in your chapter about different characteristics of families and how it either enhances or puts individuals or families at risk for problems. They talk about in chapter 34 on page 401, I believe, or it's probably 621, about the management function of the family, how it just simply exists, who's in charge of what, how things are done within the family, and how that's played out amongst family members, affecting the health and well-being of individuals. So typically in a family, parents or parent should be at the top of the hierarchy chain of management. They should be functioning in a role in which they are parenting and caring for the family, providing for the family. In families, when you have somebody that's dysfunctional, such as an alcoholic who is unable to be the parent model, it is then that the management function of the family is dysfunctional and causing problems for members of the family. Gets into boundaries. One of the video links that I have discusses boundaries, the different kinds of boundaries. The boundaries need to be clear. Clear boundaries help people function within the family and help them also to differentiate themselves. Think of prime times when people are trying to separate and differentiate themselves in the family. Think of Erikson's stages. Think of, baby going to toddler, saying no. Going to preschooler, who now there are rules and they're trying to figure out how the rules are done, and when they should utilize rules and break rules, and what reality is and what fantasy is based on imaginary play. Then we get into school-age children who are now really starting to separate into groups, play groups, that kind of thing. See how they size themselves up with peers, where they fit in the pecking order, coupled with, and then you go on, identity role. You can go through the entire Erikson stages of development and consider the idea of boundaries. And if you have clear boundaries within your family, then a person can grow to understand how they fit, not only within the family, but inside the entire world. Without those clear boundaries, when you have diffuse boundaries or rigid boundaries, that affects a person's ability to differentiate themselves safely outside of their family, not only within their family, but also outside of their family. So clear boundaries is what we want. Communication is key. Have a great video on the different forms of dysfunctional communication, and that's at a corporate level, but it speaks to 3 of your 5 dysfunctional communication forms, and I think he gives phenomenal examples of each of those. The 2 he leaves out is generalizing, where we use the words all or none. Any all or none words in communication is very destructive. It just shuts people down. So it's very important that we communicate clearly, that we point to a particular problem so that we can focus on that problem and honestly proceed with some kind of resolution to the problem. The other one, I believe he does do blaming, distracting, manipulating, I believe is the other one. You know, it's kind of a, some people would think, oh, it's give and take. Anytime you attach strings to your behavior of what you're going to do for someone, it is not healthy. You should be able to do things for other people out of the goodness of your heart, knowing that you're going to not necessarily gain anything more than just the satisfaction of, I'm doing it for this person, and not trying to make them guilt them into things. I'm sure some of you might, have a favorite grandparent or someone in your family that uses this kind of behavior to, perhaps see you on the holidays, or maybe have that you do a little something for them that they really need done and they just don't feel comfortable asking, so they'll use the manipulation. Long story short, we all use pieces of this dysfunctional communication, and I challenge you over the next couple of days before you take your exam to start thinking about times in which you used communication with someone to gain something, or to perhaps share your frustrations in one of these dysfunctional ways. And you could probably point to a time when you are able to see how it didn't work, basically, or it doesn't work on a continued basis. Emotional support. Think of our client that we saw on Friday. Think about how destructive her family life was, and how even now today she really doesn't have the emotional support that she needs. You would think after all she's been through, her mother, her sisters would break every boundary down to be with her and to love her and to hold her and take care of her. And it's just that support. We talked about serious mental illness on another video. I'd want you to understand how important and how key it is for our people with serious mental illness to have emotional support from loved ones and family. And when that cannot be obtained within the family, then they need to be able to find it elsewhere. And she's found it in the structure of Osawatomie, with the boundaries set there amongst, psychiatric care providers, which at least she's found some peace there. Socialization, how do kids learn how to interact with groups of people and what the norms of society are? Well, it begins in our family. I think a lot about this as I think about my children and what my husband and I are doing to properly socialize them within the greater part of society. Church, that's one thing that we utilize. Extended family relationships that are multi-generational. Just got together with a couple that's much older than we are, and was invited to dinner because their son, who's our age, was in town, and then his daughters are our daughter's age approximately, and valuing that and family and how we act, and just the different kinds of graces. Thank you, offering to bring something. We brought pie, she fixed dinner, the girls went out and had Brahms, that kind of behavior, although it can be subtle within families, it should be very purposeful. We should be thinking about how we are fitting our children into society in general. Gets into the different kinds of family therapy, gets into the insight and behavioral-oriented therapy. I have very good links for that within the content tab of and I suggest that you do get into that and look at that. What does a basic nurse do for family therapy? We are not therapists. I think with the links you can understand that there are psychologists and trained therapists to do family therapy. However, basic level nurses are very much involved in family therapy. When you think about psychoeducation, think about when you give discharge instructions to one of your patients in the hospital. You know, if there's a daughter or a son or a mom or a loved spouse, you are doing family therapy right there. You're teaching them about their loved one's medications. You're seeing the interaction, the communication within the family group. You can see maybe some blaming. Well, if he would have just, you know, quit his smoking and eating too much and said that, we wouldn't be in this predicament. You know, we need to stop that kind of communication right there. That is not helpful to the family. That is not helpful to the person who's ill. That is not helpful to the family at large. We need to move beyond that. So, you know, just being able to identify that way of communication as being dysfunctional, the nurse can interject some positive thoughts and some positive interaction so that, you know, when the patient goes home, that patient is benefited by the education and not blamed because perhaps unknowingly or knowingly they did things that perhaps jeopardized their health and well-being. So that's just one small example of how you can interject yourself into family therapy. Concepts central to family therapy: who's the patient? Very interesting to know that we don't need the entire family for family therapy. It can be one individual, it can be the couple. I know, you know, parents have gone as a couple to a family therapist to perhaps discuss a child within the family without interjecting formally the child within that therapy session, to maybe explore some things to benefit or enhance the relationship with the child. You can do the same thing with your spouse, or you can do the same thing with a parent. So the crux of that is to understand who the therapist is or who the patient is. And even though you can't bring the person to this session, you are the captain of the ship. You have a lot of control over communication and boundaries and relationships with that other person. And by making changes within yourself or gaining insight within yourself, you then can perhaps influence and affect the behaviors and the relationship with the other family member. That's the idea of that. Triangle, you know, that is discussed also in a video. The fact, you know, 3 persons in one exchange or one series of exchanges, and who the conflicts between, and then who is benefiting or not benefiting from that conflict. I know that I think it's the structural family therapy that kind of identifies that. Assessing, what do we do? Showed you a genogram, video on a genogram, very good video. We use this not just in psychology-based assessments, but they use it, like they said, for genetics, and they use it for also for physical histories, you know, for other diseases other than mental illness or difficulties with family interactions, that kind of thing. So I find that will be a very useful tool for you going forward. Talks about terms used in family therapy. I want to highlight that a little bit. They go over boundaries again. Remember, we have the clear boundaries, the blurred boundaries, and the rigid boundaries. Those are the 3 different kinds of boundaries. And clear is what is beneficial, and the others are destructive. Differentiation, your ability to create your own identity from your family and move forward and still be a part of that family. And we do this understanding that you have to do this as you develop throughout a lifetime. And then you have to consider also what stage of development the family's in. You know, are you a young couple just starting out? Are you a middle-aged couple maybe trying to launch kids into their own adult world? Are you perhaps the older parent who is now in need of some assistance? So remember, you know, as we go through family life cycle, it's also very, very important that you consider that. Hierarchy, I touched on that. You know, who's in charge? You know, if you have a dysfunctional parent and there's the children have to step up like the young lady did. You know, on Friday she explained how she protected her younger sibling. You know, that is very destructive to family. Multi-generational issues. Once again, we talked about abuse being multi-generational and being perpetuated over and over and over again, and trying to break the cycle of destructive behaviors within families. Scapegoating, usually blaming the weakest member of the family, and you will see this. You will see this at the bedside when you take care of patients. You will see this, you know, if you choose to become a mental health professional. You will see this in your own family. I mean, be a little reflective on that. Who gets blamed for everything? And you don't necessarily need to run to their protection all the time, but you can help them build a way, build some strength, and help them to defend themselves and not be bullied all the time. Context, remember how much important it is to know what culture our people are. Diagnoses, they give several diagnoses, and for those of you who have missed diagnoses questions on quizzes at this time, I strongly suggest that you look at those diagnoses and that you think about how they fit within the context of family therapy and nursing with patients. And this is where, you know, I'm kind of getting a hint of now, you know, I'm understanding how when nurses come into the program at third semester, there were things that you fundamentals students have learned, you know, as far as nursing, perhaps from a nurse, you know, an ADN program, that the other students maybe have not had the chance to learn these things. So I will try to be better as a teacher to highlight these things. And this is one thing that I'm seeing. So those students who have come in that are struggling with those diagnosing questions, look at that list. Think about how that fits into, you know, perhaps families. Identify, all a diagnosis is identifying the problem. What is the problem in the family interaction? What is the problem here? Risk for compromised resilience. Okay, let's take that one. If a family does not have clear boundaries, if the chronically mentally ill person, say maybe it's a teenager who's just starting into some bipolar type problems, or a major depression, which is what we see, you know, during these teenage years, and you have a parent that's a substance abuse user, and perhaps they suffer from a mental illness themselves, but it was never diagnosed, then if you have this problem, then it will compromise the person with the newly diagnosed with resilience, with the ability to get better and stay better and move on with their life and be a healthy person. So that is a good diagnosis for a family that is struggling with those kind of issues, not just the child who's the patient, but perhaps the entire family needs to look at their behaviors and get some help for other family members. And definitely, you know, the parent needs to step up and become the top of the hierarchy and caretake and manage their household, and you know, look at the boundaries and make sure that we are allowing our child to grow and make their mistakes while we are able to be the parent in that environment or in that family. So that's just a strong suggestion, especially for those people who are struggling with diagnoses. Goes on into outcomes. What do we want to come out of the therapy that the family's in? And again, you basic nurses, you won't be a family therapist, but you will be the person teaching the patient about the diagnoses, perhaps the pathophysiology. That's why I started to include pathophysiology on your clinical paperwork. And you know, Bonnie kept saying, have you not had theory about borderline personality disorder? And I love Bonnie. She is always challenging instructors and students to step up and to become informed on what is going on in the mental health realm. So that was your opportunity to look up the pathophysiology of the borderline personality disorder, and not just the causes, but perhaps the characteristics of persons who are labeled or diagnosed with bipolar personality, borderline personality disorder. What is in their history? What are some of the behaviors? Because we, in mental health, many times do not see anything in blood work or on a CT, MRI, or PET scan. We don't see anything. We just see the behavior, and then we have to figure some things out based on behaviors and destructive behaviors that are actually harming the person. So anyway, the outcomes, there are many that they list there. They all make really good common sense to me. Reduce dysfunctional behavior, reduce interfamilial relationship conflicts, mobilize family resources, improve family communication, heighten awareness, improve integration, promote appropriate individual psychosocial development. And it says, coping skills are very important. We'll get into that this week. Very important that you understand that these people, a lot of them, especially seriously mentally ill, they may never be well. So how can we help them cope with who they are? I mean, you're not going to change the brain. It is what it is. You're not going to change the fact that that young woman had a horrible childhood, was made to parent her younger sibling, now still doesn't have any true relational interaction on a normal basis with her family, and the yearning that she shared with you, all I want to do is just, we don't have to go shopping, we don't have to go to dinner, I just would like to go and be with my family and just have a normal family day. And she's been robbed of that, and still today is robbed. So coming off of Friday, I think this is a very good chapter to get into and look at and think long and hard about our own families, but about those patients that you will be seeing at Osawatomie, and a lot of them have dysfunctional families or no family at all. So you'll be witnessing a lot of this. Interventions, the intervention section, the author again, or the editor, really did well with breaking this up. Just look at each paragraph and look at what the highlight is. Be non-judgmental. Promote and monitor the family's mental health and progress. Inform, educate. Talks about family pharmacological interventions. They have a lot of good vignettes in this chapter. Good time to stop and maybe read through some of those. Just to FYI, basic level nurses, the doctor prescribes, the provider prescribes medications. We explain why they're giving those medicines a lot of times and the side effects and benefits of those medications, and that can be done within the realm of family nursing. Advanced practice interventions, they can actually counsel and give therapy sessions, be family type therapist, involve family in therapy sessions, maybe even gain some more training to do that. Self-awareness is very, very important. Knowing who you are, where you come from is very, very important. Their family is not your family. You need to nip that in the bud right there, and just decide that they are a person in the midst of family. It could be all kinds of different kinds of family, and that's outlined for you early in the chapter. It's a little different from fundamentals, so you'll want to look at that too, at the kinds of family that we consider in family therapy. So a couple important points. Remember, family therapy is a newer therapy that was developed within the last few decades. There are a lot of resources on the internet about family therapy. Basic level nurses don't have the ability to do family therapy formally, but we are involved. We are documenting behaviors of family and patients for the psychologists and psychiatrists and therapists that deal with family therapy. making observations. We are interjecting with, especially seriously mentally ill, behaviors or modeling for the family and for the ill patient, ways in which you can function that will enhance the resilience of those clients. You are perhaps the role model of the family member that they weren't, trying to teach them boundaries. Remember, a lot of our mentally ill people come to us with the lack of internal boundaries, like the young lady who cut herself. She was lacking that internal boundary to say, stop, enough, there's a better way to deal with this than to hurting myself. So anyway, that's family therapy. Good luck. Have a good day.